Good afternoon, everyone. I'd like first to thank the organizers for this opportunity. And I'll be presenting an abstract on a multi-country analysis of HIV testing strategies for identifying adolescents living with HIV. The results from work done in 17 countries that are implementing a USAID-funded EPIC project. As a background, adolescents 10 to 19 years represent 4% of all individuals living with HIV. And young people 10 to 24 contribute to 37% of all new HIV infections. Adolescents who are older, 15 to 19, they lag behind in HIV testing, particularly in Eastern and Southern Africa, the region which is mostly affected by HIV, where only 25% of adolescent girls and 17% of adolescent boys have been tested for HIV in the past 12 months and have received the results of their last test. Strategies to improve access to HIV testing for adolescents and young people are needed. So for this analysis, we describe testing data and strategies that have been implemented under PEPFAR program through USAID support in a project called Aiming to Meeting Targets and Maintaining Epidemic Control, EPIC, a project that aimed to identify adolescents living with HIV in 17 countries in Africa, Asia, and South America. So for the methods, adolescents were offered rapid HIV test and or self-test in health facility and within communities through various trained cadres, including peer outreach workers, counselors, and clinical care providers. Using routinely collected data, aggregated data from 17 countries that are listed on this slide, we analyzed the number of adolescents 10 to 19 years who were tested. Analysis by sex, by population category, that is general population including adolescent girls and young women, priority population, children of KP, and clients of female sex workers. We also analyzed by testing strategy and also by venue, whether community or facility. We calculated the case finding rate as the percentage of HIV positive adolescents 10 to 19 years among those who have been tested. So between October 2022 and September 2023, EPIC tested 1,030,000 adolescents, identifying 3,500 HIV positive, a case finding rate of 2.6%. More females than males were reached with HIV testing, that is 58%. However, case finding rate was higher among adolescent males at 3.1%. This slide shows HIV testing results by population type. The small dark blue boxes represent the case finding rate, while the white boxes represent the proportion of individuals who have been tested within each modality. Among all the adolescents tested, 43% belong to adolescents with high-risk behavior. The highest case finding was among children of key population at 7.9 case finding rate, followed by other priority population at 5.3, and clients of female sex workers at 5.2 case finding. In terms of testing venue, 50% of the adolescents were tested in health facilities with a 3.1% case finding rate, while 49.6% were tested in the community with a 2.1% case finding. A large proportion of tests was done through mobile testing. This slide is showing the different modalities. And you can see here a large proportion of tests were done through mobile testing, followed by facility-based VCT and PITC. Among the various testing modalities, we found the highest case finding through index testing in the community at 11.6%, followed by facility-based index testing at 4.7% and facility-based VCT at 4.6%. Facility-based VCT also had the largest absolute number of positives identified compared to all other modalities. Okay, so this slide is showing results by testing strategies, and we are looking at two main strategies. The first one on your left is the social network strategy, which is an approach that is used to identify, to engage, and to motivate individuals with undiagnosed HIV infection in order to mobilize them to accept HIV testing. In EPIC projects, we use peer outreach workers and mobilizers who are at risk of or are HIV positive themselves, and we give them coupons to share with their networks of peers to use to seek HIV testing services. We provide them with a modest incentive, especially for those peer, outreach workers who, for each case of adolescent that they're successfully linked to care or bring to care for testing, we give them some modest incentive. So looking at that first graph for the SNS results, we see that 4,500 coupons were distributed and these results are from 4 countries that are shown: Burkina Faso, DRC, Nepal, and Tanzania. So during that study period, for October 2022 up to September 2023, 4,500 coupons were distributed to adolescents, of which 3,700 were tested. And among those, 110 tested positive, a case finding rate of 2.9%. And among all those who were tested through SNS, the majority they belonged to 15 to 19 age group. Only 12 belonged to the 10 to 14 age band. For the second strategy, HIV self-test, 42,000 adolescents received HIV self-test, among whom 80% returned the test results, of which 229 reported a reactive self-test, which represent a 0.7 case finding. 201 were confirmed positive by rapid test. And of note here is that the 42,000 tests were distributed, but they are not distributed to unique individuals. It's possible that one individual may have received multiple test kits. And also note that the 0.7% reactive is a proxy, as the denominator is the number of kits used, and the numerator is the number of individuals who are reporting reactive screening. So to conclude, please recall that fewer adolescent males were tested. However, the case finding among male adolescents was much higher compared to the females. So for that, efforts are needed to understand program reach and also to test adolescent boys and young men, especially those with high-risk behaviors. Also, targeted interventions to reach high-risk groups, including clients of female sex workers, priority population, and children of KP, those strategies are needed in order to reach this group. HIV self-testing and SNS are potential strategies that could be further refined and scaled up to improve case finding. Facility-based testing reported a higher case finding than community testing, suggesting that we could be reaching adolescents when they're already sick. And this is calling for scaling up community testing in order to reach this group much earlier and provide them with case testing services. Index testing should be also continued, scaled, and prioritized. And also, lastly, it's very important that we engage adolescents and young people to design and to implement programs in order to make sure that the programs are meeting their needs and they're responsive to their needs. Thank you very much.